My patients often ask me, are bedbugs dangerous? Can they fly? And how do I know what to look for? Bedbugs are thought to be on the rise since the 1990s, where they were on the decline, and that's due to rising factors such as travel and more resistant bedbugs to insecticide. Bedbugs are blood-sucking insects that are most active at night, usually between 1 and 5 a.m, while bedbugs are brown, flat, wingless insects around 1 to 5 millimeters and look a bit like apple seeds. They usually need a human blood meal every 3 to 5 days to grow, and they can survive up to 1 year without feeding. This makes it really tricky to get rid of, and lots of people will just shut away something that they think has been infected by bedbugs. They might hide a suitcase in the shed, or they might hide a mattress. However, these bedbugs can live up to a year, so you need to be really careful how you get rid of bedbugs. Bedbugs are often spread on furniture, clothing, and luggage. During the day, they hide in places where there's not much light, and they come out to play during the night. What are the symptoms of bedbugs? Well, bedbugs feed at night, and most people get no reaction when they get the initial bite. Bedbugs inject a small anesthetic into your skin, and often most people don't feel that at all. In 2009, 12 scientists volunteered to be bitten by bedbugs on their arms. This confirmed that bites or reactions can take up to 11 days before they show. And in another questionnaire, around 30% of people in bedbug households reported symptoms. That means around 70% had no symptoms. Bedbugs often leave small wounds or punctures, and often they have a cluster of bites in a line or in a circle. Some people get flat purple spots, and remember that bedbug bites can look different in different skin colours. On white skin, bedbug bites usually look red, and on darker skin tones you might notice that they have a purplish colour, or they're more difficult to see. A classic hallmark sign is the breakfast, lunch and dinner sign, which is 3 or more bites in a line or cluster. These bites typically appear on places where your skin is exposed during sleep, so face, neck, arms. And my patients often ask me, do bedbugs fly, do they jump? Well, generally it's just by walking from the area where they've been hiding onto a host, which is in most cases humans. Some patients show almost no signs of being bitten. However, some people can get marks up to 1 centimeter big, which are red and swollen. In rare cases, you might get more serious reactions like cellulitis or anaphylaxis. When to see a doctor? If you have bedbug bites, try some self-care. On the whole, they're not normally anything to worry about. However, if you're getting an area from a bedbug bite that's getting more red, hot, swollen, and you're worried about infection, it's best to speak to a doctor. Other symptoms to speak to a doctor about is if you have swollen glands, high temperature, feeling unwell. This again could signify infection. If you have any signs of a more serious reaction like sepsis or anaphylaxis, seek help urgently. But remember, these reactions are very rare. How to get rid of bedbugs? Bedbugs are really good at playing hide and seek, so often you need specialist people to come in and have a look and decide how to get rid of them. One tip is to vacuum any surfaces you think might have had bedbugs, and secondly, make sure that you wash your clothes, linens or mattresses in at least 60-degree heat to make sure you kill the bedbugs. The reason that getting rid of the bedbugs is best to be left to professionals is because insecticides can be often resistant, you have to use more than one, and spraying these chemicals all over your house can have respiratory, which is breathing, skin reactions, they can have neurological reactions. So because these are very strong chemicals, it's best to be handled by professionals. Usually the professionals will have to come back around 4 to 20 days later to make sure that they don't have to do any further intervention and that the bedbugs are gone. You might want to try steroid cream from the pharmacy if you're getting a lot of itching, and you might want to try antihistamines, cream or tablet, to see if this can bring down the reaction. Your doctor might in some cases need to give you antibiotics, and that's often if you have complications from itching your skin and creating breaks in the skin. If you have impetigo or cellulitis, we might have to give you a course of oral antibiotics. but remember, it's not the only insect that can have a reaction to heat. So if you don't have a bedbug, what else could you have? Well, other things like fleas and scabies could be a cause. Fleas can have a similar pattern of a cluster of bites in a line or curve. Scabies could also be at play, but remember, scabies causes a lot of itching, and generally it can be in places like your genitals or only around your nipples, where bedbugs are normally in your arms, your face, areas which are exposed when you're sleeping. Well, the best idea is to prevent yourself getting exposed to bedbugs. So if you buy any used furniture or used items, check that you're not bringing bedbugs into your home. If you're in a new hotel or a new environment, just make sure there's no black dots or brown dots in the sheets where the bedbugs are hiding. If you're traveling home after traveling, make sure you check your luggage and your clothes and make sure you don't bring any bedbugs into your home. One interesting thing about bedbugs is they're attracted to the heat of the host, so in most cases that's a human, but it can also be attracted to other warm-blooded animals. And in general, bedbugs avoid moving host, so often they hide until it's nighttime where they come out to play. So skin-to-skin transfer and clothing transfer for bedbugs is very rare.
Please share your bedbug experiences down below and I will reply. Thank you for watching The Travelling Doc.